Right.
Good Lord.
All right, but tell me, you said you had a workout injury.
Correct. So about 2 years ago, I was working out and I loaded up way too much weight before I went to go squat. And so I put up about like 350 and I had no lifting partner, no workout belt, none of that. I wasn't paying attention and my form had it to where my back was like rolled over, kind of like that.
Uh-huh.
And so as I went down, it was like a quarter squat. All of it just pressed right on rolling.
Buckled you forward.
Correct.
Uh-huh.
Yeah. And so now it's been like that for the last 2 years where it's kind of like done the inverse where it's like the best way I could explain it is like it's like this, like twisted inwards.
Your back wants to round forward and stay stuck there.
It's like it's hard to explain. So if I were to like the little disc space in between,
Right.
it's kind of just like buckled inwards,
Compressed on the front.
Yeah.
Yeah.
And so unfortunately, I don't have X-rays for
Sure,
you right now.
sure.
We tried getting them. It's just
Yeah.
the office was a bit difficult with that. But the term has been thrown around degenerative disc loss. But then I spoke to another chiropractor, and he said, "Oh, you're way too young for that." And so, conflicting reports on that end. But I understand that I really don't have that X-ray for you.
You're fine.
Yeah.
You're fine. So, when we have an injury like that, so we have 24 vertebrae, 23 discs. The discs are made of 70-80% water. And when you have a compressive force, so you're squatting, essentially you buckled forward, and then the front part of the spine got all sandwiched.
Correct.
The disc actually doesn't get injured in that case. So you're on the right mindset that I wouldn't agree that you have a disc injury yet. Now, this injury will cause disc injury later in life, and I'll get to that in a second. But what happens when you have a compressive force of that degree where you essentially have a forward, what we call kyphotic buckling of the spine, the bone gets injured.
Yeah.
The actual vertebral body. Think of this like, the glass, and this is the sponge, right? If you throw a sponge on the ground, it's not going to get damaged. You take something hard and throw it, it's going to crack, right? So the bone is hard and rigid, and it's not even fully formed. So 26 is full maturity of all the bones in your body, and so there's some level of cartilage in here, and it's still not completely calcified. Does that make sense?
Yeah.
But that will also allow it to be able to be bent or crushed more so than it would have been later in life. And so what I would suspect we'd see is kind of more bruising of these bones on MRI from the disc. The disc will actually crack the bone. And then what happens over time is that the actual end plate, which is the contact between the disc and the bone in here, the end plate releases acid that goes into the disc, starts to liquefy the disc, and then allowing it over a period of 10 to 15 years become a disc bulge.
And that's when the disc problem comes in.
They took healthy discs out of cadavers and subjected them to thousands of pounds of pressure. They don't herniate.
Gotcha.
The reality is that you have to first damage the disc, make it go from a self-cohesive jello to a liquid. It then needs to cook its way through all the layers that wrap it to finally get to a place where it's now herniated out and hitting a nerve. The care for you at this point is a couple-fold. One, you can't feel this bone. You can't feel the disc. What you can feel is the joints in the back. And when we have an injury like that, the ligaments had to have torn to some degree. How many of them tore, how many microfibers of connective tissue in here and fascia tore, who knows? We don't have the ability to even measure it. I wish we had the technology to, like Star Trek, I watched all these episodes as a kid, and I thought as a doctor I was going to get Star Trek imaging. And then they handed me x-rays and MRIs, and I was like, thanks.
Yeah.
It's pathetic.
What do I do with that?
I wanted Dr. Crusher, like be able to zoom in and here. We can see the little tiny fibers torn. We don't have the technology. It's all blurry. When you look at the posterior structures on an MRI, we can see large injuries, cysts. You understand if something's completely ripped off perhaps. But in some cases, not even that. I mean, I have shoulder surgeons, for instance, they actually stick cameras in to verify that a rotator cuff's torn. Why would they do that? Because they don't trust the MRI. So you've had 2 years potentially to compensate, right? Where your body's now going to heal. We're supposed to have a sway in our lower back. And because these structures have feeling, on the backside, your body's going to say, there we go. It's all better. It's gone. Well, it's not gone. You're just avoiding it, right? Your body's healed, crooked. And now if you stay in this alignment for 10 years, you will have disc injury.
Gotcha.
Because the weight isn't on the joint, which has feeling, and the weight's not on the disc that doesn't have any feeling. And so part of the difficulty with your care, at least in terms of subjectively, is we're looking at you from a perspective of the next 60, 70 years, right?
Mhm.
Not the next 2 months, right? And next make you feel better the next year. I'm going to put you on a plan for the rest of your life, which is you need to have the proper alignment of your spine,
Right.
which is this lordotic curve in your lower back, and there's a lordotic curve in your neck, and your ear needs to be over your
Yeah,
shoulders.
there's not good days. It's just, like just a constant little
Show me.
tightness.
Stand up for me. Yeah,
Yep.
sure.
Like a constant level of tightness around here, and it's just like it'll spread up, it'll spread down. It's almost
Uh-huh.
like the more I do, the more the pain gets further away from it.
Sure.
And the only thing I could imagine is I'm just overusing those areas.
So when does this ever go into the glute, or does it stay just in the small of the
It's
back?
never gone lower than here.
Okay. So this is all the joints. So all the knuckles will refer pain to the local area around them. Okay. It's the sclerotogenous pain, or we call the joint pain, in these actual knuckles in here, and again, the muscles will get tight and you'll have some inflammation of the muscles in the area, which then are going to cause more kind of odd, weird symptoms as the muscles are now providing stability. It's not the job of your muscles to stabilize your spine.
Right.
Many times, a lot of chiropractors, therapists will aim patients down this pathway that you strengthen your core, strengthen your back muscles. And I go, well, how long can they do that? If I have my muscles contract, can I contract them forever? Is it the job of my muscles to be tight all the time? The back should feel soft.
Right.
And when you feel the back, there shouldn't be like, you understand?
Mhm.
Muscles tight.
Yeah.
It's supposed to be relaxed. I can tighten the muscles, but when I'm just standing, the muscles aren't contracted. Does that make
Yeah.
sense? If I go out of the right posture, right? If I round forward, now everything's tight.
It's rigid. Yeah.
It's rigid now because I'm in the wrong posture. Okay. Right shoulder's high. So when I'm looking at you, you're in avoidance of this left side of your neck. Okay, 1 second.
Yeah, and I'm putting on a bit of good behavior, but usually the forward neck posture comes out a little bit more.
And it's on both sides. So the pain's on your hips, both sides. I mean, sorry, in the back.
Yeah, both sides.
Because I don't have very much, if at all, maybe a slight right high hip, but I would say almost the hips are level. I don't have, it's like both sides of your back got punched. A couple of things are going on is that your shoulders are forward and the head's forward. Even with your shoulders forward, you're an inch forward.
Yeah.
So to make this how depressing this is, your head's forward, but it's masked by the shoulders being forward.
Oof.
So it doesn't look as bad. That makes sense? Well, Ed, I thought you're supposed to line up. It's lined up, right, but the shoulders are forward. If I pulled your shoulders back, you follow me?
Yep,
Right?
that's the cell phone.
The head is more forward than even your static posture easily shows. Any pain when you turn your neck left?
No, sir.
Turn your head right for me. It's going to do some range of motion stuff here. You can turn a little bit farther that way, maybe a little bit. But no pain either way.
Yeah, there's a bit more resistance going to the right side than on the left, but not a painful resistance,
Okay.
just resistance.
Show me that one more time then. Show me to the right. That's right. Okay. And then go ahead and turn left. Okay. Interesting. Go ahead and turn right one more time for me.
Mhm.
Keep going all the way right for me.
When I was about 5 years old, I had a trampoline incident, and
Okay.
that ended up causing neck problems for a great number of years. Now, since then, that has been resolved, but that was always like kind of like a consistent thing of like, meeting with doctors, like, okay, let's get that range of motion out there
Right.
today.
Is there anything that exacerbates the pain in your back? Is there any motions or any bending or?
So at my work, I have a bench about this high, and so I'm usually like pretty bent and hunched over at work, and that definitely,
When you're in this kind of position for hours, or
yeah,
Just-
prolonged amount of time.
being bent forward, makes that worse.
It makes that work. There's not a whole lot of things that don't make it worse. Like
Okay.
like the driving
Sitting works.
driving posture, even laying down. There's not too many things that like don't piss it off.
Okay.
It's,
All right, gotcha.
yeah, it's a
Okay.
bit of a beast.
Yeah, the knuckles, when they're inflamed, the tissue's inflamed, so the nerves are going to be upset whether you're upright or laying down.
Yeah.
Sometimes mechanically they can get more stressed and get upset, but it sounds like it's been there long enough that the tissues actually need to be cleaned, and that's where we go that gua sha. You'll see me go in there and try to get some blood in there, rinse that out. Maybe start it back for me. Take a deep breath in, little sit up, head back for me. Let it all go. Exhale. There you go. Beautiful. Yeah, nice. Deep breath in. Very good. Head back. Exhale. Let it all go. Yeah, all tight right there. Take a deep breath. Head back. Exhale. Chin down a little bit. I got you. Yeah, wow. Yeah, you're way too young to have that much tightness. Right? You felt the first one moved,
Yeah.
right? And then that's good. We actually want to close those joints. We want to squeeze the fluid out of them, but they're already moving down here.
Yeah.
The problem is you have almost no functionality of your upper and middle back and you're 18 years old. That's remarkable. Exhale, relax, I got you, bud. There we go. All right, good. Other side for me.
That was a good one.
Relax. All right, face up. Okay. All right, let me see where it is. What was it? Right, so it's left. Yeah, left atlas. All right, real gentle. I got you. Relax right here. There you go. There you go.
My body's got to decide that I trust you first.
It's okay. It's okay. Yeah, you did great. Real easy. Keep that chin up.
Yep.
Beautiful.
Nice.
Way too much tightness up here. Yeah, your neck doesn't want to really be curved. It's not falling easily into this shape, into this mold.
Yeah.
And chiropractors started off what we call segmentally analyzing the spine. So we had segmental analysis. They were so zoomed in, looking at the juxtaposition of each vertebrae compared to the adjacent vertebrae. They essentially, over time, started to zoom out, right? And look at the whole body. So there's been no, have you heard the word lordosis before me?
I have not.
Okay, that's the most saddest thing I've heard today. Okay. Curve is fine too, also. I mean, you could just say curve. But the point is that the lordosis, or the curve in your lumbar, is paramount. Your back is supposed to be arched. And when we lose that arch, especially after having an injury of that, size, that's what's gonna cause the problems. The loss of alignment.
Well, yeah, a lot of about 5 chiropractors since the injury, you would be the first to say that.
Okay,
so.
all right. Great.
Yeah.
All right. We live in therapy world. We live in a pain management therapy world, not a corrective orthodontic world. It's all dental hygienists and no orthodontists.
And show up for 3 times a week for the next 80 years.
Mixed. Reminds me of that Simpsons episode. I'll need to see you 3 times a week for many years. I got you. Yeah, I know. Yeah. It's about bringing you home. We're going home.
Yeah.
Your neck belongs back here. And the more forward the head goes, the more leverage and tightness, torque goes on your lower back. So ultimately, we can't alleviate all the stress in your lower back if we don't get the curve back in your neck. They are connected together. So Ed, it's all down in his lower back. Why are you spending so much time on his neck? Because his head's forward. And I don't treat symptoms. I really don't. I don't treat, you understand? I listen to your symptoms. Happy to tell me anything you want. But I don't treat symptoms. I treat posture. I treat alignment. And that if we're in the right alignment, there are no symptoms.
Yeah.
You follow me, right? So I don't, well, his care looks similar. Correct. I treat posture. I don't treat, I'm happy to go through what you're feeling and explain to you what you're feeling, right? But the feelings the pain that we're feeling is just a result of not being in the right alignment. You've had an injury, you healed crooked, and now we're gonna have more problems because you healed crooked. Bring me back home. All this is to I can't reshape something that's stiff, right? We have to make the spine limber and supple so that we can recast it into the proper position. So all the adjustments goal isn't just to see how many pops I can get out of your back. The goal of the adjustment is to unlock the parts that are stiff, to leave alone the parts that are loose, to balance the spine's mobility so that when you're stretching, we don't just continually put stress on the parts that are loose, that we have the pressure evenly spread. When your muscles contract, one of the end results of the Krebs cycle is lactic acid. Oxygen binds to it to convert it to carbon dioxide and water, but because it's so tight, the amount of buildup of lactic acid you're not have enough oxygen to meet the demand, right? So now lactic acid resides in the tissue, causes pain, the nerves are sitting in that acid. You follow me, right?
Yeah, so
and
even, so even though it's a really dark red, you're saying that it's not blood, it's lactic acid.
well, if it was blood, then what happens is very quickly. I had a patient the other day. He's been 4 visits. I can't make a mark on it if I tried. All that happens is the skin becomes pinkish, like a light red.
Right.
The dark red never comes out. Past visit 5, very little marks come up. Even though I'm pushing as hard as I can, or
Right.
I can't make a mark if there's not something inside to draw out.
Gotcha.
And then the patient will tell me where the mark's going to come out. And I feel that. I feel what's inside that's trapped. And then that tenderness, that graininess will go away. And then the mark will go away at the same time. I won't be able to make something. So there's a direct correlation between your subjective feeling of it, what I can see and feel objectively, right? You follow me?
Yeah.
And then as we treat it, it no longer is there. And then at the same time, you're going, Ed, my neck is no longer tender. And then we can start changing posture.
Yeah.
Right? We can't change the posture if subconsciously your body's trying to get away from all that hurts back here.
Gotcha.
I'm not here to force you into a room with broken glass on the ground and a broken TV and it smells, right?
Right.
What we do is we remodel the room, make it a nice place to be, and then you automatically go into it. Now your feet always do that. Don't move your feet. Don't move your feet. Don't move. Your feet always do that.
So my hip is tilted out,
Right.
like my entire pelvis.
Yeah.
Yeah.
Okay. How long you noticed that?
Traumatic injury when I was about like 8 or 9 years old. I've had a lot of mess. Yeah.
Okay, so you've noticed your right foot turns out
Yeah,
since
so
you were 8.
that's been, I've tried physical therapy. I somewhat just gave up on that one.
Describe the injury.
So it was tile floor, and I just, like, right about here, I just
Uh-huh.
fell the perfect way that it fully just, I don't have the best recollection of it.
I got
but
you.
That much I know.
What I'm worried about, actually, the main thing that's going to happen is your meniscus, that right meniscus, your knee, is if you walk with one foot flared like that, the inside of your knee is going to age at a faster rate. Yeah, we feel as old as the average parts of our spine that work. If you age an area at twice the rate, it will last half the length of time. And so what happens is people get to 20 and parts of their spine look 50, and parts of their spine still look 15. And it's about aging evenly. That's all we can really ask for.
All right.
We don't age in the parts of our back that are frozen.
Yeah.
Treating posture one patient at a time. Tell all your friends about me. Right there. I know.
Yeah.
Yeah.
It's a good pain.
Yeah. Yeah, I got you, bud.
That's the money spot.
Biggest worry is not even your worry right now, which is that right meniscus.
Gotcha.
That to me is going to be the first major calamity due to this injury you had at 8, or and me trying to help you treat that. I'm going to check the right piriformis and see if it's something we can.
And you're talking about that right leg being pushed out?
Foot flared, yes, sir. That's a massive amount of stress that's going on in here,
Uh-huh.
and that's what I'm worried about, is right in there.
Yeah.
That the medial meniscus is under double, triple the stress. Again, until it tears, until something blows up, no one cares. But no other chiropractor saw that and cares about that at all. Nobody's.
I mean,
They're just like, whatever.
it's been swept under the rug by everybody.
Jeez.
Yeah, and even the physical therapy was, I would say, less than acceptable. It just,
Okay.
yeah.
We got to have a plan for attacking that and treating that and strengthening the muscles that. How about this? I'll strengthen some muscles that turn your foot inwards. Does that make sense?
Makes
How about we
sense.
strengthen those muscles and maybe. Okay, he's got this bent frame, so we have to strengthen the muscles that internally rotate his foot to keep his toes straight so his meniscus doesn't get damaged. It's going to be a more expensive problem than anything I'm feeling back here. This will cause disc injury, but it hasn't happened yet.
Uh-huh.
I believe you have bone injury. The bone is injured, and then that over time will melt the disc. So we do need to treat this, but I don't think the disc most likely didn't get injured yet.
But it almost sounds like you're saying that bone injury is not the most scary prognosis.
Bones can heal. Bones
Right.
replace. Yeah. Bones replace. The vertebral body replaces. The discs don't. So it's all based on what structures can replace and which ones don't. The enamel on your teeth doesn't replace, so if you damage it, it's more expensive than cutting your tongue,
Gotcha.
right?
Mm-hmm.
You cut your tongue, okay, don't do that, but it's gonna heal.
Yeah.
The discs are poor, if not have no capacity for replacement.
Yeah.
They can be rehydrated, you know, careful with the verbiage, right? They can be cleaned,
Mm-hmm.
right? They can be not so inflamed, right? But I'm not calling that healing.
Yeah.
You follow me? Some people will call that, or even just symptom alleviation, they'll call that healing. It's like, well,
Yeah.
careful, guys. It didn't heal. It just is now no longer bruised, and it's symptomatically better. But
And so what I was told at one point is we need to revascularize the disc. You know, we need to get blood in there.
it's not necessarily a bad thing to say. The disc is going to be massively compressed, so it's going to dehydrate. That's true. I know, but I know.
Yeah. Yeah.
Doing great, doing great.
And I can even feel my body right now. Its initial reaction is like, whoa, let's get away from this guy.
Right, right.
Yeah.
Yeah, the area that's actually overstressed just needs to be compressed. There's not too much lactic acid because it's actually moving around. It's in the stuck, stiff areas next door there where you're going to find kind of the more marks come out as a result of the tightness that traps, you know, stiffens the circulation.
So obviously I can't see what you can see from
Mhm.
this position.
Mhm.
So where are you actually finding that redness? Gotcha. So not actually in the lower back, but
I mean, there's like I said, there's think of even the as your back grew, there's like stretch marks here,
Mhm.
and those stretch marks are scars. So the
Yeah.
scars actually have tangled inflammation trapped in
Right.
the marks down here, but that's not
Yeah.
really what brought you in today. This is actually the tightness up here that's contributing to the overstressing of that area.
Gotcha.
There is some inflammation. I mean, it's like it's all just kind of old blood that's just trapped in these old scars in here.
Oh.
Get the circulation flowing in here.
That right side's not reacting the same way the left did.
Yeah, it's more inflamed over here. Yeah. Yeah, right there. More tender. Is that what you're saying?
Definitely more tender.
Yeah,
Yeah.
yeah, there's more.
Yes.
Yeah, pretty strong mark coming out on the right side here, right above it. Let's see how this piriformis is doing.
Yeah. Because I mean, you know, after I injured it, I pretty much stopped pretty much any working out.
Uh-huh.
And just mostly stagnant lifestyle to compensate for the pain.
I got way too much tightness in here.
Yeah, it's like going down the entire glute.
Correct.
Yeah.
You know, part of it could be that, I guess, again, when you were young, it was supple and it bent, let's call
Mhm.
it. But I got a lot of muscular tension here that I think is contributing to that foot flare.
Gotcha. Yeah, that on the side up there,
Uh-huh.
that's from.
Yeah, my goal with the care would be to get all of this tenderness out of here.
Right.
That how can we really know where your posture wants to be if the nerves and the muscles are all acting in a manner because of the inflammation in the area. So we have to clean out this inflammation and then see how the body changes, and then maybe an image of your lower back or pelvis and see if there's anything anatomical we can see from a childhood injury. And it's usually a series of treatments you got to go through here until this area is not so sore. It's like I'm going in and stirring it up so that it can leave. And then as your care progresses, Ed, you can push as hard as you want. There's no more tenderness, and then the foot flare's gone.
Yeah.
But right there.
Oof.
Relax, I got you. Relax. There you go, I got you, bud. There it is, nice, we got it. You all right?
Yep.
Yeah, feel that?
Yeah, more pressure on the sternum.
But you feel that it actually moved back here?
Yeah, I felt that.
These joints actually moved. You gotta start practicing kind of at home when you're not working, you know.
Mm-hmm.
You kind of hang out in this kind of position. Make sense? And try to arch back a little bit, work on your extension. You're really good at bending forward. I want you working on what you're not good at.
Mm-hmm.
And how we can accomplish this also laying on our back, laying on our backward, and you actually put pressure on your back.
Gotcha.
Okay. Right.
Good Lord.
What I'm saying is that's that right side. Is
Yeah.
that bigger mark.
Jeez.
You know, like I combed that just as hard as I combed that.
That's top down, correct? Like
Right,
when you're
your head's
standing
here,
there?
head's
Okay,
here.
yeah.
And then, like I said, these are the scars, just stretch marks. You know, but there's scar tissue in there. Relax, relax, I got you, bud, I got you. So you're not holding it straight here.
I'm not.
I fixed them.
Well, my point is that I want you working on, I think, like I said, the muscles in your glute here, okay? That goes from the side of your sacrum to the outside of your greater trochanter.
Yep.
Tightness in the glute, foot flares, and you're going to wear out, I'm just telling you, we're going to wear out this inside of the knee in here.
Yeah.
It'll be right in there. And that's what I'm worried about, and this is an expensive piece in here.
Yeah.
Let's not wear out meniscus.
Well, for whatever reason, right now, let's be a bit more naturally straight.
I got you, I got you. Just see how. Good, okay, you feel good. I don't have any. Yeah, there's
There's
some
also there's
contraction
no way
there.
that you massaging my glute a little bit realign my pelvis.
Well, I'm just saying
It-
I can alleviate the muscle contraction, right?
Gotcha.
So part of it could be muscle contraction, but correct, if it's an anatomical, like say the bones were supple and they shifted, you know, I don't, it's throwing stuff on the wall and seeing what sticks. This is tighter here. Feel the vastus medialis, feel the difference? This is all soft. I got no contraction here.
I will say last couple of weeks, my right hamstring incredibly tender.
Uh-huh.
Yeah, like I'll bend over to just grab a box at work, and then all of a sudden I'm grabbing my hamstring like I'm like some old guy.
This is where I'd work. Get get somebody to dig on these quad right here. This will alleviate the pressure on the meniscus, but this is a result of the foot flare.
Yeah.
Is contraction, vastus medialis gets cut tighter.
Oh.
That right there is going to cause problems. Yeah, there's no contraction on the outside, just all this the inside of the knee here. Uh-huh. Uh-huh. Nice. 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 I got you. Nice, I got you.
Yep.
Okay. All right, man, sit for me. Okay, now press back with your elbow into my elbow, so you're gonna press.
Yep.
Let's keep it relaxed.
Okay.
Let's get relaxed. There you go.
Nice.
It's okay. You go. Arms to the side. Stretch your shoulders back. We're trying to get these shoulders. Come back. Trying to open up the front part of your body.
Right.
I have one more book behind you. Eventually, this is gone. I have one more behind your head. This is your chiropractor. They made this is the neck version, but not the one you're on, but it's the same principle that they took a emulation of my thumb
Mm-hmm.
and they made it into a device that,
Wow.
copies, that gives you a retainer.
Mm-hmm.
It's a retainer for the care that we did on the table so that your adjustment holds for longer.
Mm-hmm.
There is no way for any adjustment to hold if we're not doing something to change the ligaments that wrap the spine.
Yeah.
So the tight ligaments on the front that you felt earlier when I lifted your torso up, right, and I had you arch back, you were like, something in my sternum.
Mm-hmm.
This hasn't stretched very often, right?
Right.
And this actually has to expand open to receive this to go forward,
Yeah.
right? This is supposed to be easy.
Right.
And then I had you with up this high. Eventually your head comes back and this conforms to the mold.
Yeah.
That's why there's no sharp. There's not supposed to be any sharp.
So you're not feeling pain.
Nothing.
That's insane.
The fact that you feel that sharpness is the injury. You have to close that joint. You have to restore your lordosis. We cannot adjust a curve back into your spine.
Mm-hmm.
If somebody's telling that your posture can be changed through adjustment, they don't know what they're talking about. The adjustments are necessary to make this change of posture.
Mm-hmm.
So they do go together, but it's not the adjustment that changes your posture. It's 20 minutes. Around 15 to 20 minutes, you'll feel a great desire to get off this because your ligaments are actually stretching.